Now let's discuss about the blood supply of the heart. Heart is a structure which will be supplying the whole of the body, right? It will be pumping the blood to all the parts of the body. But the wall of the heart itself also needs the blood supply. So heart is also supplied by some special arteries which are called as coronary arteries. There are two coronary arteries, right and the left coronary artery. So if you can see here, this is the picture showing the two arteries, the right and left coronary artery. This is the section taken at the level just above the aorta, semilunar valves of the aorta, as well as the semilunar valves of the pulmonary trunk. So here you can see the two openings. So this is the aorta and this is the pulmonary trunk, and you can see the three cusps of the semilunar valves. And here you can see the beginning of the right coronary artery, and this is the left coronary artery seen from above. So there are two arteries, coronary arteries, which will be supplying the wall of the heart, the right and the left. Anatomically, they are not end arteries, but because they anastomose with each other, the right coronary artery will be anastomosing with the left coronary artery, but physiologically they are end arteries, because even though they anastomose and the branches anastomose, but it is not complete. So if there is blockage in one coronary artery, the other artery should compensate, but the other coronary artery does not compensate as expected. It is supposed to compensate completely, but it compensate for some extent, but it is not enough for the wall to survive. So that's why this is, even though anatomically they anastomose with each other, physiologically they are end arteries, even though they anastomose, because they do not compensate as necessary. These arteries are also called as vasovassorum of the ascending aorta, because vasovassorum are those arteries which will be supplying the wall of the blood vessel itself. But here the ascending aorta will be giving these branches, and it will be supplying the heart. So that's why even though they are not supplying exactly the blood vessel, but they are supplying the main structure which will be the part of the circulatory system, that is the heart. So that's why it is also called as the vasovassorum of the ascending aorta. So whenever the heart beats, especially the left ventricle, when it is systolic in nature, it contracts and it pushes the blood to all parts of the body. So usually all the blood vessels or the arteries will be filled with blood, and they'll be supplying the different structures when they are in systole. But in case of the coronary arteries, these are the only arteries where the blood flow will be in the position of diastole, not in systole but in diastole, because once the blood is pumped from the left ventricle, it will be pushed into the aorta in systole, and it will be pushing the blood, gushing the blood to all the parts of the body. And when the heart relaxes, especially the left ventricle, the blood will regurgitate and come back to this position, but these valves close, and so it cannot go back into the heart. So this blood now it starts flowing into these coronary arteries. So these are the only arteries in the body which will be flowing the blood during the diastole instead of the systole. So the right coronary artery, will study these arteries one by one. The first one will be the right coronary artery. This is the artery which is called as the right coronary artery. This is the ascending aorta. So at the beginning, at the root of the ascending aorta will be the beginning of this coronary artery. This right coronary arteries, as I said, arises from the anterior aortic sinus of the ascending aorta. If you can see here, so this is the anterior aortic sinus. So it will be beginning from the anterior aortic sinus. So if you can see here, all these are the three cusps of the semilunar valve, and here you can see here this is the left one, and this is the right one or the anterior one, and this is the third one which is called as the posterior. So the right coronary artery will be beginning from the right or from the, it is also called as the anterior aortic sinus. It passes between the pulmonary trunk and the right auricle. So if you can see here, it begins from the beginning of the ascending aorta, then it passes between the right auricle. This is the right auricle, and here is the pulmonary trunk, which will be supplying the deoxygenated blood into the lungs. So here you can see here in between the pulmonary trunk and the right auricle of the right atrium. So this artery will be arising, and this artery descends. This is the course of what we are discussing in the course of this coronary artery, the beginning, the course. The artery descends downwards along the right atrioventricular groove. As we have studied already, the groove between the right atrium and the ventricle is called as the atrioventricular groove, and this artery will be running along this groove. This is called as the atrioventricular groove, and this right coronary artery will be passing through this. So it descends along the right atrium, atrioventricular groove, and winds around the inferior border. If you can see here, it goes down, and then this is the inferior border between the sternocostal surface and the diaphragmatic surface. This is the inferior border, and it winds around the inferior border, passes left of the diaphragmatic surface, then it goes on the diaphragmatic surface and gives a very important branch which is called as the posterior interventricular branch. When it goes, if you can see here, this can be seen, even though it is not usually seen, but they have shown this artery so that you can imagine exactly where it is present. It is going on the diaphragmatic surface below, and then it gives a branch. This is called as the posterior interventricular branch of the right coronary arteries. And this artery is a very important anastomosis, shows anastomosis between the right and the left coronary artery, because it will be anastomosing with the anti-interventricular branch of the left coronary artery. So this is a branch from the right coronary artery, that is the posterior interventricular branch, will be anastomosing. If you can see here, this is the anti-ventricular branch of the left coronary artery, winds around this again, the inferior border, then goes and anastomoses with these two. So these two arteries will be anastomosing with each other, even though physiologically they are not completely anastomosing with each other, and they cannot compensate for each other. The main artery itself anastomoses with the circumflex branch of the left coronary artery. If you can see here, this is the main artery which will be going again further, even though it gives a branch here, posterior interventricular branch. The main the main artery itself will go here, and then it anastomoses with a branch from the circumflex branch of the left coronary artery. Okay, so it will be anastomosing with the circumflex branch of the left coronary. This is the left coronary artery which will be giving a branch which is called as the circumflex branch, and it will be anastomosing with the main artery here. What are the branches of this right coronary artery? We have already seen the branches. One of the branch will be, we have already seen, that is the posterior interventricular branch. Along with that, there are other branches which will be coming. So the branches from the first part up to the inferior border, this will be called as the first part. From the beginning up to the inferior border, that will be called as the first part, and the remaining will be called as the second part. So the first part will be giving some branches. One is the ventricular branch. Ventricular branches, so many branches are coming, which will be supplying the right coronary artery. One of the artery will be called as the right coronary artery. The second is called as the right anterior ventricular rami, which will be supplying this main right ventricle. Then there is atrial rami, which will be giving a branch called as a sinoatrial nodal artery, which will be giving a branch, very important branch, which will go into the SA node, and that is called as a sinoatrial nodal artery. Branches from the second part on the diaphragmatic surface, we have seen already one very important branch, that is called as the posterior interventricular branch. So this is the posterior interventricular branch. Along with that, there is also the right posterior ventricular rami, as well as the right posterior atrial rami. It will be again the posterior branches also supply the right atrium as well as the right ventricle. So these branches will be called as the the right posterior ventricular rami as well as the right posterior atrial rami. So all these are some of the branches from the first part and the second part of the right coronary artery. First part, which is up to the inferior border, from the beginning to the inferior border, that will be called as the first part, and the remaining will be called as the second part. Okay, so the first part will be given the ventricular rami, which will be a right conus artery as well as right anterior ventricular rami, and the atrial rami, which is supplying the say nodal artery. The second part will be giving some important branches, the right posterior ventricular branch, the right posterior atrial branches, along with the main branch, the posterior interventricular branch. So this is all about the right coronary artery. Now let's see what are the beginning, the course as well as the branches of the left coronary artery. So the left coronary artery is much wider compared to the right artery. This is much larger artery and supplies larger volume of the blood because it is larger, wider, so it will be giving out larger amount of blood. Arises from the posterior, left posterior aortic sinus of the ascending aorta. We have seen this. This is called the left posterior. So this will be the left posterior aortic sinus of the ascending aorta. Passes behind the pulmonary trunk, then between it and the left auricle. So first when it begins, so it is coming from the left posterior aortic sinus, then it comes here and passes behind the pulmonary trunk. It is going behind the pulmonary trunk. This is the pulmonary trunk in the front, and that's why it is shown in the slightly a lighter color, because it is winding behind this pulmonary trunk. And then between it and the left auricle, if you can see here, this is the left auricle. This is not the left atrium. The left atrium big chamber will be behind, so this is just the auricle of this left atrium, which is called as the left auricle. So it will be passing between the pulmonary trunk and the left auricle. Then it divides. As soon as it come here, then it will be dividing into two branches, main branches. One is called as the anterior interventricular branch. So if you can see here in this picture, so this is the anterior interventricular branch coming here, and then the circumflex branch. So both are the branches of the left coronary artery. As soon as it comes here near the auricle, it will give the anterior interventricular branch and the circumflex. Anterior ventricular branch will be anastomosing with the posterior interventricular branch of the right coronary artery, and circumflex branch also anastomosing with the main branch of the right coronary artery. So what are the branches from the anteroventricular artery as well as circumflex artery? So the anterior interventricular branch gives anterior ventricular rami as well as the septal rami. So it will be giving very important branches. The anterior interventricular branch will be giving some important branches. One is the anterior ventricular rami and the septal rami. So anterior ventricular rami will be supplying mainly the right ventricle as well as the left ventricle, along with the septal part, which will be supplied by the septal rami. The circumflex artery. So if you can see here, this is the circumflex artery. So this circumflex artery will be giving the some important branches. One is the atrial and ventricular rami, which will be supplying the atrium and the ventricle of the left side, left atrium and the ventricle. Then sinoatrial nodal artery, then left marginal arteries. The right one will have the right marginal artery. Similarly, the left circumflex artery will be giving left marginal arteries. Then the posterior interventricular artery, if you can see here, the posterior interventricular artery will be there. So here also this is the posterior ventricular branch of the left coronary artery, along with the right one, and the Jugal's artery. So these are some of the branches from the circumflex as well as anterior interventricular branches. Now, what are the areas supplied by each coronary artery? You should know how much percentage of the blood supply is supplying the heart, and how much is by the right and how much is by the left, and which are those areas. So the right coronary artery supplies the whole of the right atrium, because as you can see in the picture, it is much towards the right side. So it will be supplying the whole of the right atrium, the most of the right ventricle except a strip along the anti-interventricular group. So it will be this right coronary artery also supplies by the ventricular branches to the whole of the right ventricle except a part of the area supplied by the from the anti-interventricular area and anterior interventricular group. The posterior inferior one-third of the ventricular septum. The ventricular septum between the left atrium and the left and the right ventricles. So that interventricular septum between the right and the left ventricle, especially the posterior inferior part, will be supplied. One-third of this ventricular septum will be supplying this part. Then the SA node and the AV node, both the important nodes which are the pacemakers of the heart, are also supplied by the right coronary artery. So if there is any damage to the right coronary artery, this is one of the important system which will be affected. Coming to the left coronary artery, it supplies most of the left atrium as well as the left ventricle. Most of the left atrium as well as the left ventricle except a strip along the posterior and inferior surfaces, especially near the posterior interventricular area groove. So there it will be the supply will be to a lesser extent. So most of the left atrium and the ventricle except a strip along the posterior and inferior surfaces. Also antero-superior two-thirds of the ventricular septum. So it will be supplying the anterior two-thirds of the ventricular septum between the two ventricles, and the posterior one-third will be supplied by the right coronary artery. Now coming to the venous drainage of the heart. Almost 60% of the venous blood of the heart drains via the coronary sinus into the right atrium. There is a large sinus which will be called as the coronary sinus. The main vein of the heart is called as the coronary sinus. That will be draining almost 60% of the venous blood will be going to the right atrium through this coronary sinus, which is the main vein of the heart. What about the remaining 40% that will be supplied or drained by the, you have seen small veins called as the foramina, venerum, minimerum. Those will be draining the remaining 40%. So almost 60% will be drained by the coronary sinus. Remaining venous blood drains into different chambers via the vena cordis veins as well as as I said, the foramina minimerums. So those will be draining as well as in the vena cordis veins. Okay, the coronary sinus conveys greater part of the blood from the left coronary artery. So major quantity of the blood will be drained from the left coronary artery. The coronary sinus conveys greater part of blood from the left coronary artery. The anterior cardinal veins drain most blood from the right coronary artery. So the cardinal veins, especially the anterior cardinal veins, will be draining most of the blood from the right coronary arteries. So we'll talk about this coronary artery, coronary sinus in much detail. So what are the tributaries of this vein and how it begins and ends? So it is, this coronary sinus is a wide venous channel of the heart present in posterior part of the atrioventricular groove. So it is present in the posterior atrioventricular groove. So this is the coronary sinus. You can see here from the front, you cannot see, but still they have shown the impression, so how it looks. So this is the posterior view, exactly it is present. So it is present in the atrioventricular groove. This is the atrium, the right atrium, this is the left atrium, this is the ventricle especially, and the right and the left, mainly the left ventricle. So between the atrioventricular groove, this coronary sinus is present and receives almost 60% of the venous blood. What are the tributaries of this coronary sinus? One is the great cardiac vein. So if you can see here, this is the great cardiac vein which is draining into this coronary sinus. Then we have the middle cardiac vein that is also draining, the great cardiac vein, then the middle cardiac vein, as well as the small cardiac veins, as well as the posterior vein of the left ventricle. If you can see here, this is the posterior cardiac vein as well as the posterior vein of the left ventricle. as well as you can also see the oblique vein of the left atrium also sometimes drain into this coronary sinus. So these are all the tributaries of this coronary sinus, and the coronary sinus is the main vein which will be draining almost 60% of the venous blood back into the right atrium along with the superior and inferior vena cava to be purified. So this is all about the blood supply of the heart and the details of the heart. If you have any doubts, you can write to me and I will try to answer. So these are the references. Thank you very much.